Hello, everyone. I'm so very pleased to welcome to our summit Dr. Jan Bonhoeffer. Dr. Bonhoeffer is an expert on infectious diseases as well as vaccine safety, a pediatrician, and a former emergency room physician. He's the founder of the nonprofit foundation Heart-Based Medicine, which we'll be speaking about. He's the author of the new book, Dare to Care: How to Survive and Thrive in Today's Medical World. It's really a beautiful book, and in it we are reminded that essential harmony and well-being are our natural states. The book offers us an invitation to join a new bandwidth of caring, intuition, holism, and love. Dr. Bonhoeffer, welcome to the summit. Thank you for taking the time to join us.
Thanks a lot, Dr. Mills. It's a great pleasure. Thanks for having me.
Yep, pleasure. So you have multiple areas of expertise relevant to the science of healing. And I'd like to start our conversation with a highly internationally significant topic, and that is of the SARS-CoV-2 virus and also the COVID-19 disease. And I want to note that you're a former consultant to the World Health Organization, as well as to the Center for Disease Control in the US, and that you led a vaccine safety initiative. So with that as a background, from my point of view, there are many lingering questions about the virus and the disease itself. But I think among the most significant questions is this one. And that is, what questions should we be asking about the new COVID-19 vaccines?
Okay, well, great question. Thank you. So let's try and unpack this a little bit. So first of all, we want to save lives. And so the first question is, does the vaccine protect persons at risk of serious COVID? So the death toll is tragic. It's now 2 million. And the numbers of lives saved by all other vaccines together annually, globally, is that number. So it is a serious question. So we want to see, does the vaccine meet that goal? Second, we want to protect lives. So the second question is, does the vaccine immunize the spreaders? So what about the healthcare professionals, those working in hotels, restaurants, transport, so they can open up without being at risk of infecting others? Third question, and maybe most important to me now these days, is that can we see beyond the vaccine and the virus? So if we recognize that the vaccine protects against the virus, but it doesn't heal the pandemic of fear, and the collective fear is alarming and revealing. And I would ask the question, are we ready to look into the abyss of the human condition and evolve from this collective fear?
Beautiful. I'd like to see that happen. Well, speaking of the vaccines, then let's start with some more specifics. So how can we as the public, we have these two new COVID vaccines that are out there, and they're technically under emergency use authorization and currently considered investigational. So how can we as citizens gauge the safety of the vaccines as well as the effectiveness, which is something you just, you mentioned, of course. Are they effective?
Yeah, so two aspects to this. Yes, the vaccines are new, yet the research into the construct of these vaccines is 20 years old. So we know mRNA vaccines for 2 decades now. And a lot of research has been put into the question, how can we prepare for a pandemic like this so that the vaccine construct is ready, and we only have to plug in that one little thing that is specific to the disease and we're ready to go. So a lot of research has gone into it, and that provides a good evidence base of, let's say, security and certainty that we can move on with this. Now, the safety data for this specific vaccine are still pending. We have safety data from a few 10,000s, and now they're coming in from a few millions. So gradually we're getting this. But in order to be really safe, we need to have probably the data on something like 50 50 million and more,
Mm.
and that's still pending. So that's why we want to focus on those at high risk right now, rather than the entire population in the beginning.
In one of your writings, you note a poll that about 60% of Americans, for example, are open and willing to receive the vaccine. However, 40% are wary, and actually they do not want to proceed with this vaccine, partly for some of the reasons you were just describing, I think, perhaps that it's new and not fully tested. What would you like to say to those 40% who have not yet gotten in line?
I'm not sure. To get in line is kind of a public health campaign perspective, and I'm fortunate to be an academic, so I don't need to blow that trumpet. So immunizations are a highly individual decision making. So there is the public health perspective, but primarily for me, it's a 1-0 question and not so much a public question. Yes, we want to take responsibility for the collective, for sure. So for myself, if I'm at high risk, I would certainly want to consider the vaccine, and probably the odds are that the vaccine is effective and saves my life rather than creating a serious risk. If I'm a healthy person or even a child where the illness isn't really that serious, I can really understand the caution and the idea to let's wait and see what the experience shows with those who are at high risk and for those who for good reasons take that risk.
I really appreciate that message, and frankly, that is not a message we hear, at least here in the U.S. I don't know about over, throughout the U.K. and Europe, but we don't hear that, and that leads me to another question I had for you that I really very much like to understand. And this has to do with concepts of informed consent and the messaging that we have here commonly in the U.S. So, for example, the CDC website says the vaccines are very safe and effective, and that's been disseminated through a lot of medical groups too, who have evaluated the data. But historically and typically, particularly in your field as an expert in vaccine safety, what does that mean specifically? Because we know there are adverse effects out there. They're listed on the VAERS site, the CDC, and so how is I, as a consumer, and people weighing whether to proceed or not, and wanting to understand what is safe, what's the threshold where I might not be safe or where I will be safe?
Yeah, that's a really good question, and it's kind of the holy grail question for everybody right now. So, so first of all, because this is really highly individual, I'd say this is the question to ask the primary or the healthcare provider of your trust, and of your and have that conversation, because they know you best and they can probably help you gauge that situation best. Stepping one step back, what does it mean when the CDC says the vaccine is safe and effective? I would say it means that's the current state of ignorance. Okay, so our current state of learning, our current state of ignorance is that it's safe and effective. So on the tens of thousands that we've tested it, it looks effective and it looks fairly safe. So now we're getting into the millions, and I'm sure we will get a lot of false alarms. That's what we get every single time when we immunize millions and millions of people within a short time frame. We'll get all sorts of hypotheses and signals, as we call it. You mentioned VAERS or other methods of vaccine safety monitoring post-licensure. We'll get a lot of messages and a lot of signals, and a lot of them will be false alarms, if you like. And it will be the major mandate now of those in charge of vaccine safety and monitoring the safety of the vaccines to differentiate between the many false alarms and the few really important ones that we need to learn. And that's what we have to wait for. So, yeah.
Thank you for that. That's very helpful. What in your perspective, with your long-term expertise as a consultant, for example, for the CDC, WHO, and perhaps elsewhere that I didn't mention, what would take us across the threshold where you would say, you know what, actually they're not safe. We thought they were, but now we've got tens of millions of data points. You're an academic. I'm an academic. I like data. I need data. What would occur that you would then say, okay, you know, they really weren't safe. We thought they were, so we've just been pushing ahead. What would happen?
Yeah. There's no one size fits all answer to this question. So there's no one number where we say, like, you know, if we reach that one number, then that's what is true for all adverse events. Again, it depends on the individual. So let's say, you know, I'm at risk of serious COVID disease. And so let's say if I meet somebody with COVID, an infected person, and I'm likely to be infected, my risk of dying from this illness is 1 in 5, let's say. Okay. So now we're looking at a vaccine that has been tested in tens of thousands, and we haven't seen anything. So it already looks like overall the vaccine is safer for me in my situation, right? Now, if I'm a healthy person, then first of all, the basic law is first do no harm, right? Primum non nocere. So the basic law, I'm primarily healthy. So now, am I willing to accept a risk of, let's say, 1 in 100,000 of having an autoimmune disease? Well, I'm not so sure if I'm ready to have, you know, an autoimmune disease 1 in 100,000. We all know this, for example, with influenza vaccine. So with influenza vaccine, we have a situation where influenza as the wild type illness causes Guillain-Barré syndrome. So that's a neurological disorder that has an inflammatory basis. And it's a serious illness. So it's transient, but it's serious. So the vaccine also causes this, but 20 times less likely than the wild type disease. So one of the things we would need to look at, not only is, we shouldn't only look at what is the risk ratio, but we should look at what is the benefit risk ratio. So comparing what is the risk with the wild type illness, what is the risk with the vaccine, and what is the risk without both. And that's an individual decision making for any of those outcomes that might be important to us. And that's the conversation to have with your healthcare professional, I would say.
Thank you. That was extremely lucid and well spoken. Thank you. And helpful for me and hopefully for our listeners as well. Cool. So I'm going to move away a little bit from, we've been focusing more on the kind of biologic health consequences potentially of the, the virus and the COVID. Earlier, you mentioned pandemic of fear. And you used the word in one of your writings, doom scrolling, which I had never heard. I like it. I'm going to remember it. But the pandemic of fear is, gosh, I'm not going to say it's been even more significant than the numerous deaths you mentioned. No, but it's gripped us, and it's really reduced in such significant ways people's well-being, quality of life, led to a lot of suicides as a result of just the massive fear. Fear is like a soul killer, you know? And so what would you like to speak with us about how to overcome this kind of state of chronic fear from the current situation?
So fear to me is the opposite of love. Kind of one of the opposites of love. It is probably the strongest separator that I'm aware of, the strongest emotion or feeling that creates a sense of separation, a sense of isolation. And to me, kind of this is what moved me away from working in the field of vaccine safety as a forefront runner, is that I realized after 20 years of service in this domain, we're kind of missing the elephant in the room. There is this pandemic that is much larger than flu or COVID, and it is a transmissible disease, and it doesn't only affect patients, but also doctors. And doctors are actually transmitters of that disease. And I say that because I can say that because I plead guilty too. And that is non-love. So it is the non-love that we're infecting each other with. And it is not consciously, but it is because we've been trained in a system that has drummed the heart out of us. And here are the consequences that we need to bear. So what is it? So I feel that to me, it is even more important than developing vaccines for deadly diseases is to see what can we do to recognize, to create an awareness globally that love is the primary healing force. I'm not talking about romantic love. I'm not talking about the result of speech and action, like so you feel like, oh yeah, that's a nice guy. I'm talking about love as a generative field, as an underlying field that then, as a result of that, transforms my action and speech. And that's why I started the Heart-Based Medicine Foundation. That's why I started the movement.
Yes. Well, I know you've also done work on certainly the nature of the mind, which I want to speak with you about, and sciences of healing, particularly consciousness itself, and the forces of love. So from your understanding of your own personal experience or medical experience or the scientific research, there's studies out there. When somebody's residing more centered in a state of love, unconditional, true love is a foundational aspect of our being. Is that's healing, number one, I know that. Can that provide resistance to getting ill, potentially even maybe I contract a virus and it doesn't quite get a hold of me in the same way as it might have if I was more in a fear state?
Well, with that question, I need to turn to you. You're the expert in the field of psychoimmunology. So this is where your expertise is far greater than mine. And I'd love to have a conversation about that. To what I can see as a consumer of this body of research, this is quite strong evidence by now that there is. If we accept that disease is part of our reality, and we accept that reality is not what is, but we accept that reality is our perception of what is, our conceptualization of what is. So the Latins nailed it. This re is the thing, and realitas is our perception of that thing. And in that regard, the way we see illness is the gate to healing. And that's where the difference is between cure and healing. So what I learned at doctor school was about cure. What I didn't really learn about is about healing. And that's what the kids taught me. The kids taught me that healing is mommy's hand, mommy's lab, mommy, that's where the healing happens, right? So I'm fortunate to be able to create an environment, an enabling environment for a healing process. But I haven't really learned to guide the healing process in children. And I feel it is a part that is sorely missing from the medical training of healthcare professionals. It's a little better for nurses. There's still the emphasis on care, but for physicians, certainly it's missing. And I would also argue that both physicians and nurses and other therapists would greatly benefit from that.
Yes, I mean, that's a theme. That's a purpose of why you wrote the book, which I introduced at the beginning. And the foundation you founded is to, propagate, and also hopefully with that work, you'll be teaching people and teaching us how to do it, how to implement. Can you speak about how your foundation is going to move this forward for implementation?
Yeah. So there are a lot of initiatives out there right now in this direction. And certainly the Chi Institute is leading, is pioneering this field. And there's a lot of organizations now in the field who are really very active. And that's wonderful. So I see heart-based medicine as one, if you like, one wave on the ocean. So one wind wave on the big swell that is happening right now. And so we hope to contribute, particularly with a focus on healthcare professionals, training into self-care, into an awareness that we have been trained to live in the upper 5 centimeters of our body. And we have learned to be fairly arrogant about being the deliverer of the solution, while the patient is kind of the holder of the problem. And there is a transformation needed. There is a deep transformation needed in both the understanding of the healthcare professional, probably more taking the role of a coach than taking the role of the wisdom of all. And also the patient. I wish that the patients are empowered to the degree that they are requesting a state of mind in a healthcare professional that they deserve. Right now, we're failing both patients and healthcare professionals. And I wish that the aim of heart-based medicine is to provide training and to provide education to healthcare providers and patients to really claim their initial motivation and claim what they deserve in terms of healing rather than cure.
Yeah, I love that. And as you're speaking and describing it, it reminds me of, that was really the impulse that started what was called the whole person medical movement, at least here in the US. It was more the late 70s, and that then evolved into what was the alternative medicine movement, and that morphed into complementary alternative, and then morphed into integrative medicine. Lately, it's called integrative health, which the vision of that is really to see the full mind, body, spirit of the person in front of you. They're more than a symptom of the disease, as you were just describing. And it's been somewhat successful, certainly in small domains where the centers for integrative medicine exist. I haven't seen it, overflow out into the main biomedical hospital systems as you're describing. It hasn't, but I hope your book and your foundation can get us many steps forward on these initiatives.
If we work together, we may be able to do it. I think we're all holding a little lamp, and together that light may actually, if we can create a lens that bundles this light, the small little lamps, to a laser beam, that would be the vision.
Indeed, lasers are very powerful. Can you share with us any of your own personal practices, spiritual practices, et cetera, that you've used to help cultivate your own heart and love space, and really, I think in many ways perhaps helped you have the realizations that you have that have led you to seek to transform the medical system that you are a professional in?
Yeah, sure. I was fortunate that I had the opportunity, the grace of being with spiritual leaders. And that has really helped me to see beyond the kind of frame that I was given in medical school, and then later in the hospital environment, and later in the public health environment. And that helped me see that this division between arts and science in academia has not been, has served for a while, but it's time to bring those two together. And so, yes, I have recognized that as I have learned to scrub up before surgery, as I have learned to brush my teeth before I leave the home, there is also there is a need to take care of my inner state before I go to work, and also before I come home from work. So the way I do this is by practices, for example, setting the tone for the day. So in the morning, I tend to get up very early. I get up at 4:30, and that's when I start to, I kind of sneak down into the kitchen so my kids and my family don't wake up, and I'll prepare a glass of warm lemon water to get some alkaline, liver awakening, all of this, wonderful. And then I sit in silence, and that is usually like half an hour, 3/4 of an hour. And that is really just being in stillness and just that. Sometimes when I'm tired, or when I realize I'm kind of waking up a little discombobulated from some dream maybe,
Mhm.
then I use breathing techniques. So any variation of Tonglen breathing, for example. Heart Math is providing a beautiful variation on that theme. So heart-based breathing, for example, or heart lock-in, then as they call it. So that is beautiful. That's part of the process in the morning. And then there's energy work. So I will do Qigong for about half an hour as well. So simple movements that I can do every morning that will help center, balance energy, and then that really is the kind of spirit with which I start to wake up the kids and we start the day, and then all the craziness of the day starts. So that's an example. And another, maybe at the end of the day, it is journaling about what did I learn today and what would I like to do better tomorrow. So every day I screw up. Every day I screw up. And initially I didn't notice that. And what helped me was that we had a training, a safety training from a flight safety training. So the head of Lufthansa flight safety gave a training, and he said basically every pilot makes an error every 10 minutes. And then they're corrected. They're kind of self-correcting and nothing happens. And so then kind of the pyramid of escalating kind of problems happen until there's 1 in, I don't know, 10 million or something, there's a plane crash. So here's if I accept that I make mistakes all day, rather than pretend that I'm a cool Dr. Know-it-all, then every day there's something to learn, something where I would like to do better next time. And that's what I note every evening. So every day I have a little lesson to learn, and that's great.
Well, I hope you go on the lecture circuit and start lecturing to medical students around the world to help get them in this headspace, because what you describe is beautiful. You're extremely vigilant and diligent about putting yourself in the proper space, not only for your family, but your patients and your work. And that's beautiful. Thank you for that.
It's rewarding. It is very
Yeah.
rewarding. It comes back 10 times. I learned that this is actually much faster than saving time and being efficient. I'm far more efficient ever since I take time to care for myself, and since I take time to care for the patient and take time for the patient. It's one of the main messages for my residents is, initially when you meet the patient for the first time, take time. You half an hour, 1 hour at least. You'll be saving hours and hours and hours of chasing results thereafter.
There is that. Yes, indeed. I'm compelled, based on what you were just describing, and you spoke several times about the importance of love, overcoming fear. From your point of view, what exactly is love?
Love is what remains if everything else is not necessary anymore. So love is our natural state. That's when I look into a newborn baby's eyes, that spark in the eye, that wide openness, that kind of that is love. Love is nothing sweet. It can be sweet. It can be very rough and tough too. So children are my love teachers. They're my love masters. Yeah, they're not always sweet. They can be very straightforward. They can be very unforgiving. They're not taking any prisoners. So but deeply caring, unconditioned, fresh, inspired, creative. So all the beautiful things that emerge from what remains when I'm not trying to fiddle with the past or adjusting the future. So it's that little gap in between where there's nothing necessary, where it's just okay to be.
Mm-hmm.
I don't know. Does that work? It's difficult.
Well, I'm going to give that a thumbs up. And I'm assuming you mentioned earlier that you've used to spend time with spiritual teachers. Perhaps you still do. I think they too would give that a very good thumbs up. So thank you for your perspective on that. And so I'd like to learn a little bit more about your Heart-Based Medicine Foundation, particularly for the attendees of the summit. How can people get involved and support the foundation if they were so inclined, or to help get the message of the foundation and disseminate it to their respective homes and practices?
Yeah, great. Thank you. So it's a very humble, simple process. This is a bottom-up process. So if there are healthcare professionals, if you're a healthcare professional, if you're a patient, and most healthcare professionals are patients too at some point, then if you resonate with this message, if you feel that this is a valuable cause, first of all, we would like to learn from you because you have value to add. Everyone has a specific lesson learned. Everybody has learned in this process. And so that learning, I feel, is valuable to gather and to collect and collate. So show up, sign up, register, and share. That's the first step. So this is a process where we have different fora for sharing and for interaction. And this is where we collectively learn. So nobody is the wisdom holder and having, preaching some new ology or osophy. This is really kind of professional to professional, heart to heart. Let's have a conversation and see, can we create a transformative field that starts to radiate and have kind of create a ripple effect. So that's one. And two is, yes, we have a core team and we have a foundation and we wish to have an impact. And typically that requires resources. And so if you have resources of whatever kind that you would like to bring into this, whether it is a collaboration, a partnership, a granting possibility, a financing possibility, whatever those resources are, everything that we can kind of point towards this mission and vision of transforming medicine so that we're really serving both healthcare professionals and patients better in the future is appreciated. So contact us and let's talk about it.
I really appreciate that. Thank you. And we'll make sure it's on the webpage for the summit, for your particular webpage. Well, I'm very much appreciating too, just the physician healthcare side of it, because that often historically has not been so attended to. You mentioned that at the very beginning when we started speaking about the whole COVID phenomenon and the toll on our healthcare workers. At the University of California at San Diego, where I am as my full-time position, there's been a new institute founded, and it's the Institute for Studying Compassion. And there were some grant monies donated to help get the institute started. And the initial pots of grant funding are going to research to study physicians and what kind of programs can be implemented to support not only the physicians, but the healthcare workers throughout the UC San Diego health system. There's programs specifically to help develop compassion, for example, and in that context, addressing burnout, which, as you know, gosh, I don't know if it's the majority, but such a highly significant number of physicians, healthcare workers are literally burned out in the system these days and are retiring, quitting. Some have committed suicide, for example. So the need is so great. So your foundation is tending to everyone on it within the system on both sides of the healing relationship. Yeah, thank you for that.
Yeah, wonderful. And this is, I've read about this initiative, heard about it from the initial donation, and I'm following this. So yes, this is very much, this is just such a wonderful initiative and such a worthy organization and network that is growing around this. Yeah, I'd be very honored to collaborate in this initiative and to contribute and add value to this initiative. There are a number of ideas that I would love to share.
Great. Are there any closing remarks you'd like to share with the attendees, specifically keeping in mind this is on the sciences of healing, but it doesn't have to be the science per se. It's about resources for all of us to be able to support our, let's say, well-being first and foremost, and also our health as well.
Yeah. So what I've learned in different professional contexts is that one of the most valuable and healing experiences for healthcare professionals is to actually be in contact with colleagues and share. And this is what heart-based medicine provides, is a community to share and to exchange and to learn and to grow and strengthen ourselves, really to support each other. So everybody who appreciates that is heartily welcome. On the website, there's kind of 2 labs. There's a care lab and a skills lab. So there's a number of, if you like, practices and insights that we make available for free. We are developing, in the book Dare to Care, there's a number of insights that I have shared with my granddaughter, not granddaughter, with my, goddaughter. It's my goddaughter who is a resident right now, and sort of that's 16 important lessons that I have learned, and with practices. So there's a resource that is available for both self-care as well as for ways to increase resonance with the patient, and with that increase healing capacity, and with that also reduce or increase patient safety, as that is one of the key components of patient risk is a lack of heartfelt care. And that it usually isn't addressed. So when we look at patient safety reports, we look kind of at one step after that, at the symptomatic side of safety issues, but not at the root cause, which to me is very often the lack of heartfelt care. And maybe the final lesson, the final message would be to all the colleagues that might be listening to this episode and to this amazing summit that you're putting together. Thank you for that. I feel we could really give a lot of attention and do ourselves a favor if we focused on appreciation. We kind of take ourselves for granted, particularly when we're exhausted. And if we make it a point, like just a tiny little practice every day, that would say, today I want to explicitly say, do, or express appreciation for one of my colleagues, or if you're a patient, to one of the healthcare professionals, just as a sign of a little bit like the Zulu greeting, Sawubona, I see you. Just a, hey, I see you, heart to heart. You're great. Thank you for doing what you do. So thank you, Dr. Mills, for doing what you do. And thank you for putting this amazing summit together. And it's a great pleasure.
You're so welcome. I'm grateful for your time, your thoughtfulness and clarity of how you described all of your experiences and your efforts of transforming medicine as we know it into something that is truly a healing environment. So thank you, Jan. And it's been great to connect with you.
Thanks, Paul.
All right, great. Until next time.
Great pleasure.